Okay, so you want to nail the OET listening test? The absolute first step is getting your head around its structure. So let's dive right in and break down what you're up against, the timing, the questions, and what skills they're really testing.
So here's the big picture. You can see the test is split into three main parts, A, B, and C. And the key thing to remember here is that it's all about spoken English in a healthcare setting. The whole thing runs for about 45 minutes.
Yep, 45 minutes. That's your total time from start to finish.
And in those 45 minutes, you've got 42 questions to tackle. Now, here's the catch. You only get to hear the audio once for each one. So you've got one shot to catch the information you need.
So what's the magic number? It's 30. Out of those 42 questions, you need to get at least 30 right to pass. That's the target you should be aiming for, your benchmark for success.
Okay, so what's the big deal about OET listening? Why is it so different from, say, IELTS or TOEFL? Well, it all comes down to one thing. It's focus. We're talking about real-world, workplace English, not boring academic stuff.
Just take a look at this. On one side, you've got your typical academic tests with university lectures about, astrophysics or ancient history. But OET? No way. It drops you right into a clinical setting. You're going to be hearing actual conversations between doctors and patients, or nurses talking to each other during a handover.
And they really go for authenticity. This means you're not just listening to clean, scripted English. You're going to hear natural, conversational language. People will use idioms, there'll be different accents. Basically, it's designed to sound exactly like what you'd hear on a typical day at a hospital or clinic.
All right, let's zoom in a bit. We know there are three parts, but what do they actually look like? Because trust me, each one is its own unique challenge with a totally different format and skill set.
So here's that breakdown in a handy table. The first thing you should notice is just how different these parts are from each other. Look at the timings, the types of questions, the audio, it all changes. Let's start with Part A, because it's a big one.
Okay, Part A. They call it the consultation, and that's exactly what it is. Your entire job here is to listen to a conversation with a patient and pull out the key details.
So here's how it works. You get two different consultations, and they're each about 5 minutes long. As you listen, you'll have a set of clinical notes in front of you with a bunch of blanks. Your task? Fill in those gaps. You've got 12 gaps for each consultation, which means, 24 questions just in Part A. That's a huge chunk of the test right there.
So what does that really mean? Well, the skill they're testing is, for all intents and purposes, dictation. You're listening for very specific words or short phrases and writing them down word for word into the notes. Simple as that.
All right, let's shift gears and look at parts B and C. This is where the test moves away from that detailed note-taking and starts checking your bigger picture understanding of workplace chat.
So the format here is totally different. Part B gives you these short little workplace conversations, maybe a handover between nurses. Part C is longer. Think presentations or interviews. But for both, the task is multiple choice. You're not writing down words anymore. Instead, you're trying to grasp the main point or figure out what a speaker's opinion is.
Okay, so we've seen all the pieces of the puzzle. Now we can step back and see the single most important thing about the structure of this test. And honestly, it's what makes it so challenging for a lot of people.
And this is it. This is the big takeaway. More than half of the entire listening section is a dictation-style task. Think about that. Part A has 24 fill-in-the-blank questions. That makes dictation the number one most dominant task you will face. It's where most of your points are going to come from.
And this chart just makes it crystal clear, doesn't it? That huge blue chunk, that's Part A. Those are your 24 dictation questions. Look how much bigger it is than the other sections combined. The test is literally screaming at you where its focus is. This is where the battle is won or lost.
Now, look, I know the dictation part can sound intimidating. A lot of people really struggle with it at first, but here's the good news. The way they set up these tasks in Part A is actually very, very consistent. The patterns repeat, and that means it's a skill you can absolutely master. With the right kind of focused practice, you can get really, really good at it.
So when you think about how to prepare for this test, the structure itself is giving you a giant hint. It's a roadmap. Given that more than half of your final score comes from just one type of task, well, the question you should be asking yourself is pretty obvious, right? Where are you going to start your practice?